So welcome everybody. Thank you so much again for making time. We have a lot of great insights as well as inspiration to share with folks today. Whether you were inspired to come because you're friends of Tamara, you're a fan of Dr. Cole, or you're already part of our now included community, y'all could be anywhere in the world. So thank you again for choosing to be here. For those who don't know me, my name is Wynn. I am the Director of Community and Growth at Acclinate, where our now included community was created for us, by us, to help our communities live healthier. I'll be moderating today, and the goal is really just for everyone to walk away with information that can help you and or your loved ones make more informed health decisions. Really the only housekeeping item I have is to stay engaged. I know this is a webinar and that it's really easy to maybe just turn on and kind of walk away and do your own thing. But I think, again, there's some really great insights that will be shared today. So if you could please just stay engaged, check out the chat, ask questions. There will be polls throughout. Then that will make the experience better for everyone involved. So with that, I will pass it on to our esteemed panelist. Let's kick off with Tamara. If you could please introduce yourself.
Yes, good afternoon, everybody. I am Tamara. I am a mother, a wife, a Google sales leader, and I was diagnosed with multiple myeloma in November 2009. And today I am excited to say that I am now a proud member of the Now Included community. So it's nice to be here. Thank you.
Thank you, Tamara. Dr. Cole.
Yes, I'm Craig Cole, and I'm a hematologist and medical oncologist at Michigan State University Carmine's Cancer Institute. I'm also a dad of three wonderful girls, including a set of twins. And I've been doing this for almost 20 years now. And so I've seen a lot of evolution in myeloma that we'll talk about. And I'm also part of the Now Included community.
Amazing. Okay, so we'll kick off with a little bit of engagement. We are curious to just understand what brought folks here today. And is it that maybe you yourself have multiple myeloma and are looking for a community? Maybe you don't have it, or you know someone who does. So I'm going to launch this first initial poll. And if y'all could just really quickly let us know, I think that will help to kind of frame the conversation a little bit. Tamara and Dr. Cole, can you see the results as they're kind of coming in live? Y'all look great, by the way.
No.
The earrings, the bow tie, everything.
Thank you.
Okay, well, I will share the poll. It looks like we have almost everyone responded. We got 2 more people. I'll give them like 10 seconds. And Tamara, did you answer the poll?
I did not answer the poll.
Okay, got it. That is okay. That is okay. I was just curious because we do have at least one attendee who does have multiple myeloma, and 32% of folks on the call have someone in their life who has multiple myeloma. So there are definitely folks here who are familiar with the condition, but there are folks who don't have multiple myeloma and may not know what it is and just came to learn more. So Dr. Cole, can you maybe kick us off by just explaining in plain language what multiple myeloma is?
Yes, so myeloma is a cancer of the plasma cells. And then the big question is, what's a plasma cell? So inside your body, and specifically inside your bone marrow, there's a part of your immune system that helps fight off infections. Those are the plasma cells. And so they produce antibodies that destroy infections. And just like any other part of the body, just like the lung can get lung cancer, the colon can get colon cancer, if those plasma cells become mutated and become cancerous, then we call that myeloma, multiple myeloma. So why is it called multiple myeloma? Multiple means many places. and myeloma means of the marrow. And these plasma cells, because they live in the marrow, when they become cancerous, they do some unusual things. One, they'll produce lots of antibody. And so just like their normal counterparts do, the myeloma cells will produce lots and lots of antibody that actually drown out the normal immune system. So one symptom of myeloma is that people can have unusual or recurrent infections. The other thing that those plasma cells will do is that they'll go to different areas of the bone and of the bone marrow and begin to wear away at the bone and to thin out the bone, and eventually can cause holes in the bone that we call lytic lesions. Lytic meaning punched out. And so that's the multiple part, because those can be in any bone in the body and can cause weakening of the bone, which can cause bone fractures. So another symptom of myeloma that we associate, and now frequently, about 60% of myeloma patients will have some type of bone pain before they get diagnosed, because these plasma cells that usually live in the bone marrow, when they become cancerous, can cause thinning, destruction of the bone, causing bone lesions and pain. The other thing that these plasma cells will do, because the normal blood production factory that makes your red blood cells that give you oxygen and energy, and other blood cells that come out of the bone marrow, these myeloma cells also live in the bone marrow. They'll push out the normal production. They'll gum up the normal production of blood cells in your body, so people can become anemic. And when people have anemia, then they have a low red blood count, but they can feel really fatigued, really tired, really worn down. And so another symptom and sign of myeloma is fatigue and anemia. A couple other things that these cells will do is that these plasma cells can, again, they produce protein, they produce antibody. Sometimes they produce little fragments of antibody that can get stuck in the kidney, because the kidney should be filtering the blood and should be filtering out poisons out of our body. And they try to filter this protein made by the myeloma cells, but the protein gets caught in the filter and starts to destroy the filter, the kidneys, the normal function of the kidney. So people's urine doesn't change, but the fact is that the urine doesn't contain the same poisons that it used to be, because the myeloma cells destroy the filtering of the kidney. So people will have kidney problems, kidney failure. And that's usually measured by the creatinine test. And then the final thing that these myeloma cells will do is that when they start wearing away at the bone and they start to cause those lytic lesions, it can raise the blood calcium level to unusually high levels. And when the blood calcium level gets really high, then people can start to have real bad fatigue. They can move really slow. They'll pee a lot. They'll have weight loss, sometimes nausea, sometimes unconsciousness, because the calcium level can get so high. And so that covers, and we usually use CRAB as our mnemonic to remember those signs and symptoms. The C standing for high calcium, because those myeloma cells would wear down the bone, raising the calcium levels. The R stands for renal or kidney dysfunction, where the protein gets caught in the kidney, causing the filter of the kidney not to work very well. So those poisons stay in the body, causing fatigue. The anemia that we talked about, where people can feel fatigued and have shortness of breath when they walk and get around. And then the B of CRAB stands for bone disease. And that's the multiple part, where people can have pain, bone fractures, and what we call those lytic lesions. So the CRAB criteria.
That's super helpful, Dr. Cole. Feel like any type of acronym that is easy for folks to just latch onto and keep in mind for future purposes is definitely welcome. And thank you, Camille, for putting that in the chat for us. I was doing it at the same time.
Yeah.
Go ahead.
And just one other thing that can happen is that inside myeloma, there's another more rare disease called amyloidosis. Well, what's amyloidosis? You remember those proteins I talked about that the myeloma cells can produce, those plasma cells can produce? Well, sometimes if the plasma cells are mutated in just a certain way, they can produce those light chain proteins, or those proteins. And those proteins, instead of just being filtered by the kidney and getting stuck in the kidney, they can actually get stuck in the tissues. And when those amyloid, those light chain proteins produced by the plasma cells get caught in the tissues, then it can cause tissue damage. So myeloma can cause kidney damage, but those plasma cells are mutated in just a certain way. The protein can get stuck in the kidney and in the heart, causing heart damage, can get caught in the kidneys, causing kidney damage, of course, can get caught in the nerves, causing neuropathy or nerve damage, caught in the liver. It really can be caught in anywhere except for the brain. And when those proteins get caught in these different tissues, it can cause heart failure, kidney failure. And that's the big problem with myeloma and amyloidosis, is that these diseases can look like a lot of other things. And the good thing is that they're easy ways to screen for. So I always tell people, if you have heart problems, you have kidney problems, if you have pain, just do the screening test for myeloma, get out of the way. If you have it, saves your life. If you don't, you move on.
Thank you, Dr. Cole. It definitely looks like there are like some people in the chat who resonate with what you're saying. I think someone mentioned they actually have AL amyloidosis. And thank you, Guy, for your question about the difference between multiple myeloma and smoldering multiple myeloma. We can save that for towards the end, and because I definitely want to make sure that, as Tamara is nodding a lot as Dr. Cole is talking, right? So I know that some of these symptoms have been familiar to you over the years. So definitely wanted to give you a chance to share a little bit more about your experience getting diagnosed with multiple myeloma, maybe how some of those symptoms have affected your life over time.
Definitely. And thank you, Dr. Cole, for being so thorough in that explanation. I've been living with this for a long time, but it's always refreshing to, hear it again from a doctor's perspective, point of view. And it's so funny because I actually presented with
Hmm.
uh, every single symptom that you listed there. It was pretty crazy and radical for me, but like I said, I was diagnosed in November 2009. However, I do believe that I probably could have been diagnosed earlier. If I had known more, or even if doctors thought that I might. I don't want to say be a candidate, but that I might be inflicted with this, and that's because earlier in 2009, I would say it was June, I had gone to a normal, regular, appointment with my gynecologist, who thought that she noticed something odd in my urine, and then sent it on to a urologist. That urologist checked everything out and actually said, "We see something. However, because you are 33, I was 33 at the time, because you're 33, it could be something or it could be nothing. And because you're 33, it's nothing." And I went along with that and I went on about my life. And probably about 5 months later, it's when I actually experienced the bone pain that you described. And it came on fast and furious for me. It just so happens that I have two children. They were very young at the time. And my youngest son was 3. And when I was attempting to put him in the car, I just felt something give in my back. And I just chalked it up to, I'm a mother, I'm picking up my child, he's getting bigger. So maybe I hurt myself. But that pain went on and it was excruciating. It was unlike any other pain that I'd ever experienced in my life. And so I'd gone to a couple of doctors who did x rays, but I don't know if the x rays just did not show any lymphatic lesions at that point, but it was decided that I should probably do what is it, PT, get some physical therapy on my back. And so I did that. And I see you scowling. That probably wasn't the best idea. Now I realize it probably wasn't. I could have probably hurt myself even worse. But I did that, but there was no relief whatsoever. And honestly, I would say, and this happened around October, but towards the end of November, that's when I was fatigued like no other. I mean, I could barely work. I could barely get out of the bed. I was feeling just ill. I was insatiably thirsty. That back pain just got worse to the point where I stood up one day to use the restroom and I passed out. And I don't know if I passed out because of the pain or if it's because of, the low blood count, the low hemoglobin, but it was everything going on. And so for me, I did not go to the doctor though right away because this happened on I think it was a Saturday. And so Monday, I said, well, let me just walk into a clinic down the street from where I live. I walked into this clinic and a doctor saw me, and it was a woman, and she was a Black woman. And based on the description, just based on all the symptoms that I was expressing to her, she grew really concerned, so much so that she suggested I go to the emergency room, and she actually called the ambulance. So I was picked up from a clinic, driven to a hospital locally, and once I was seen, I think right away the doctors almost excused me because they said, "Well, you know what? You haven't really been eating. I think you might be dehydrated. Everything else looks okay, even though I had lost weight and I didn't feel well and I passed out. But fortunately for me, I had a sister that was there. My family showed up and was pretty adamant, like, no, there's something else going on. It can't be that she's dehydrated. There has to be something else. And so while I was there, I actually attempted to use the restroom and passed out again at the hospital. And so from that point, the doctors did run a series of blood tests, and it was at that point I got diagnosed. I remember receiving a blood transfusion then, and I was wheeled onto the oncology floor probably just a couple of hours later. And I could read. I understood what oncology meant, but I didn't understand why I was going there. And so that's when the questions began. But for me, it was I had the low hemoglobin levels or hemoglobin levels. So I was experiencing anemia. I was told that I had high levels of calcium in my blood. The dehydration or the insatiable thirst and using the restroom, they told me was the renal activity. And I had all of the bone pain in my back. And so that's how I got diagnosed. I got diagnosed on a Monday and I started chemotherapy that Friday. I was never released. I started chemotherapy immediately, just 4 days later. And so the bone pain has been something that I've dealt with over the years. Most recently, I actually had to get what's called a kyphoplasty in my back because of the compression fractures. Um, but a lot has changed. I would say at the beginning, there was a lot going on. I mean, the fatigue was out of control. Every single thing that Dr. Cole just described is what I experienced. But I oftentimes wonder if that diagnosis was made earlier, would I have experienced crab? And that I don't know, but I can definitely say that it can present in several ways. But for me, it was pretty aggressive by the time I found out.
Thank you so much, Tamara. And I know I'm not alone when I say that I am very grateful that that doctor did listen and see you and make sure that you got the treatment that you needed. So I see some hearts. Can we get hearts for Tamara's experience? Maybe some claps for Dr. Cole's great explanation. And thank you for the kind messages in the chat as well. Again, y'all can continue to use that and ask questions too that we can save towards the end, save for towards the end, excuse me. So thank you both. And Tamara, as you were talking, you mentioned those misconceptions, right? You were younger, they're not usually seeing Black women patients come in with the symptoms of multiple myeloma. So unfortunately, people didn't necessarily diagnose you as soon as they should have. So just on the topic of misconceptions, Dr. Cole, are there any other misconceptions that you've seen or would like to highlight to make sure that people don't get dismissed or don't dismiss their own symptoms?
Yeah, that Tamara, I mean that's an incredible story. And I'm just so happy that you found everything that you needed to get treated. And one of those misconceptions is that myeloma is the same in everyone. And it's not. It is. That's why sometimes people say it's multiple myelomas, because everyone's different with this disease. There are distinct differences between the races in myeloma. So one misconception is that myeloma is the same in everyone. And Black people usually, people of African descent, not just in the United States, but people of African descent all over the world, will present about 10 years younger than their Caucasian and Asian counterparts. So myeloma can occur in Black people younger than their Caucasian counterparts. The other thing is that some of the signs and symptoms are a bit different between the races. But when all things being equal, even though that Blacks have twice the incidence of myeloma than all other races, that all things being equal, that actually Black people tend to do better with this disease than their Caucasian counterparts. And so, that's a couple misconceptions. The other misconception about both myeloma and amyloidosis is that it's impossible and very difficult to diagnose. It's not. It's just three blood tests will rule out the disease. Is a serum protein electrophoresis, or an SPEP, looks for that protein. Free serum light chains, which look for the little fragments of protein that are produced by those plasma cells. That evaluates for myeloma and amyloidosis, and a test called immunofixation, which looks for that protein. Those three tests will diagnose 99% of myelomas, 100% of amyloidosis. Will definitely let you know if you have it. Three tests, all that you need. And so when you see your doctor and you have back pain, or you see your doctor and you have fatigue, or you have kidney problems or heart problems, you say, can you just rule me out for those things? Those three tests negative, done. Those three tests positive, you got to be evaluated to make sure, because the other misconception is that myeloma is difficult to treat. And even though we haven't found a cure for myeloma yet, we are very good at treating myeloma. The response rates for myeloma therapies in 2023, newly diagnosed patients, really is running 99 to 100%. With the new therapies that we have available today, which is very different than what we had in 2009. And so, can we treat myeloma? Well, the misconception is that we can't, but the truth is that we really can.
Thank you, Dr. Cole. And speaking of treatments, that's a great transition for another topic that we wanted to make sure to cover throughout this conversation, which is clinical trials, right? It can be a taboo topic, but here at Acclinate and Now Included, we don't shy away from all the resources and information that might help people make more informed health decisions, and that includes clinical research opportunities, right? So I'm going to turn it back to the audience and ask folks to just let us know your initial thoughts on clinical trials. So I'm going to pull that next poll up. Launch. So y'all should see two questions. One is to help us understand, okay, who has already maybe been a part of clinical trials? And I'm not sure is a very valid answer. Okay, we've had folks who have been through things as serious as stem cell treatments and not been sure because it wasn't communicated super clearly as to whether or not that was a clinical trial. So no wrong answers here. And thank y'all attendees for engaging, because we have about 90% of folks have responded. We'll give another 10 seconds for any final responses here. Okay, so it looks like about 30% of folks have actually already participated in a clinical trial at some point. And then if presented with the opportunity, 72% said yes. And I'm sure for most people on this call, we understand why that's fairly significant, just given the history of clinical research in communities of color, the fact that we've come to a point where the majority of people on this call understand and are willing to participate, because at the end of the day, without our participation, we don't have representation and efficacy in the solutions, right? So that makes me heartened to see that 72% of folks are open to it. And Dr. Cole, can you speak a little bit more to why this is important and maybe the disparities that you've seen when it comes to treatments? And then, of course, Tamara has had some experience with clinical trials herself, so we'll hear from both of you around this topic.
You know what? I mean, it makes me, so happy to hear, what the poll results were, because there's research that has looked at the exact same thing, because there are a lot of people a lot of doctors in the research community that say, well, people of color don't want to be in clinical trials. People of color have distrust against clinical trials. All the research that has been done shows that that's not true, that people of color are as willing, and actually Blacks and Hispanics are more willing to undergo clinical trials than their Caucasian counterparts. And so to hear those results go right along with that research has validated. So, the reason why it's so important in myeloma, and really in cancer clinical trials, why it's important to be on clinical trials, is that that's where the cutting edge therapy is. So I had mentioned, the response rates for myeloma therapy are at 99 and 100%. The reason I know that is that people were involved in those clinical trials and experienced that 99 to 100% response rate. So when people want to get the best, newest, hottest therapies for myeloma, the way that they get to those is through a clinical trial. Which in brief are very controlled circumstances to see if changing a medication, adding a medication, having a new medication in the regimens that we already have that are fantastic, if we can make it even better. In myeloma land, the bar is set so high already that only the best clinical trials are now available in myeloma because the bar is set so high, which is really exciting about people being involved in clinical trials, because it's really hard to lose when the competitor works 99 to 100% of the time. And so the trick is, how do you know that all these therapies will work equally in everyone? How do you know that there aren't any unforeseen side effects or unforeseen benefits in clinical trials unless different groups are involved? So I mentioned that between the races, between people of African descent and European descent and Asian descent, myeloma is a little different. And because of that, we need to have involvement of people of really all races and ethnicities to make sure that these treatments work equally. When I see a Black woman in my clinic, I want to make sure those drugs work well for her. The only way I can be assured of that is that they're Black from the clinical trial. If they're Hispanic, if there's a Hispanic man that's in front of me, I need to make sure that Hispanic people in those trials to make sure that these therapies will work for them.
Thank you, Dr. Cole. And this is something I didn't mention earlier, but Tamara and I actually used to be coworkers. I used to actually get to sit side by side with her. And at one point, you were undergoing a pretty serious treatment for multiple myeloma. And I remember you had to take off, and we put together like a gift for you to make sure that you had that little care package. So Tamara has just always been a light, even while navigating work, motherhood, being a wife, and thriving with multiple myeloma. So if Tamara, you could share a little bit more about your experience with clinical trials, I think the attendees would appreciate that.
Definitely. Yes, I think I do represent those poll results because I have participated in a couple of different clinical trials. And the one that you're referring to, Wynn, is a CAR T trial that I participated in at the end of 2018. And I knew going into that trial that there would be a lot of risk, but I also knew that the rewards could be extremely high. And at that point, I had been under my doctor's care for about 9 years already. So the level of trust that I had with my doctor was really high. um, I have to say that, when one is considering a clinical trial, of course, there are lots of questions and there's lots of paperwork and consent forms that the patient is given, and they can be upwards of 40 plus, pages of information. But I made sure that I read every single page because it's just that important before you decide to participate in a trial. But I did participate in that trial. I had actually gotten on the wait list for that trial, probably maybe a year or two before that, because, like I said, my doctor, they keep me very informed about what's coming down the pipes. And when there was an opportunity for me to participate at that point, I wanted to be at the front. I wanted to be a part of the cutting edge of this new therapy. I also had experienced, when doing clinical trials, that you get a heightened level of care. The care is good anyway, but when you participate in a trial, I find that you get a heightened level of care. The access to the doctors and the medical team is even greater than when you're not participating in a clinical trial. And so I also know and recognize that when you agree to do a clinical trial, it's very voluntary, which means if I'm finding that the trial is not working for me for whatever reason, it's affecting my quality of life, or I just wake up one morning and decide I don't want to do it, I have that right. And so knowing that makes it a lot more comfortable for me to participate in a trial. And so the one that you're referring to, when it was a CAR T that is now FDA approved, I'm excited about, and I feel good knowing that I was a part of that data set that contributed to it being FDA approved. Because, like Dr. Cole said, if we want to know that these medications and treatments are going to work for the entire population of myeloma patients, then we need to make sure that we have a diverse set of data. And I went into this particular trial, which meant 2 weeks in the hospital, away from my family, away from family and friends, which is never an easy thing to do. But for me, I'm always focused on the potential outcome. And it ended up being a really positive experience for me. It honestly did. It was actually the first time I had achieved remission. Like Dr. Cole said, all of these new treatments are, they're turning out to be very effective. And I had been on several different lines of therapy before that. And this was the first time that I achieved remission. And so it was a good decision for me. Eventually, that drug, like I said, it did become FDA approved. I potentially could have, had I not done the trial, there were other drugs that I could have been on. But to know that I'm a part of advancing medicine, it gives me goosebumps to know that I'm a part of that. And so for me, I'm always looking for my purpose. Why is this happening to me? And if I can help advance and be a part of, us getting closer to a cure, then 9 times out of 10, when a trial comes my way, if it doesn't, look super duper scary, more than likely, I will definitely consider it. And I'm glad that I did in that instance.
Thank you so much for sharing, Tamara. And we do have some questions from the audience. I think one of them, Dr. Cole, you can help answer. So just be prepared for that because they're asking about the blood types and the test that you mentioned earlier, as well as whether or not people can have more than one at once. So just I'm queuing you up for those questions. And also for the attendees, I worked some magic in the background where I allowed everyone to talk. So if you didn't put your questions in the chat, then feel free to unmute yourself in a moment. But before we move to Q&A, I did want to give Tamara a chance to just speak a little bit to your day-to-day, because I've seen you working out, going to different events and things like that. So you're definitely living a full, beautiful life. So maybe share with us some milestones, some highlights that you've had over the years, even while navigating multiple myeloma.
Definitely. So today you look at me, and I look pretty healthy, and I would say that I am pretty healthy. When I was first diagnosed, I went through, like I said, all those different symptoms and had to go through some pretty aggressive treatment and, lost my hair, weight suffered quite a bit. But since then, all of those things have come back and I had to find a new normal. And honestly, one of those new normal meant not not going to my doctor every month and asking, am I in remission? And instead of focusing on, am I in remission? I focused on, how do I feel? What can I do? What are the things that I used to enjoy? And why not continue doing those things? So over time, I have definitely, found those things that I enjoy and I take advantage of it. You mentioned working out, and I definitely do work out. And part of that was 100% prompted by the fact that because of all the medications I had to take at one point, it did affect my weight. And so my weight did go up to a level that I was like, all right, hold on a minute. I don't want this to control my entire life. So let me do some things. If I can't control myeloma per se, maybe I can have an effect on my weight. So I joined a boot camp, and I do that pretty regularly, honestly. Like for the last several years, if it's not consistent, at least a few times throughout the year, you will find me working with a dedicated trainer, trying to make sure that not only just for my, for the sake of my weight, but just for the sake of making sure that I keep my bones healthy because we know that myeloma can affect the bones. But first and foremost, I'm a mom. At the time, my children were 3 and 7. Today, they're 21 and 17. So that meant that I needed to continue to mother. I work full time. I never honestly stopped working. Once I got diagnosed, I did take 5 months off because I went through a lot, stem cell transplant and other things. And so I did take some time out. But once I got back into the rhythm of what does my new life look like, I made sure that I did those things that I used to do before, which is traveling with my family, spending time with my friends and family, going to, to live music concerts. Of course, I'm very, conscious of my environment. And so I make sure that I'm protecting myself, from potential germs that could be out there. So I've been wearing a mask, when I'm in public places probably since 2009. I know the pandemic made everybody, very aware of these airborne, germs, but I was kind of ahead of that, right, because of the diagnosis. So it definitely did affect my life at the beginning, and I had to be extremely careful about where I went and what I did. And I was always waiting, for permission to live my life. But I stopped waiting for permission. I just decided to live. If I feel good, then live. Like this life is to be lived. And so I make sure that I do just that. I travel, I work, um, I cook sometimes. I spend time with my family and I do, what I'm doing right now, which is hoping to educate. And so that's what my life has been like.
Thank you, Tamara, so much. So remember, folks, take away that you don't need to ask for permission to live, as well as crab. Okay, so get kind of both side of things. I'm also team cook sometimes, Tamara, so you are not alone there. And I see that we actually have a live question, so hopefully the folks who entered the questions in the box will forgive me for allowing Kyle to come live with his question. Kyle, feel free to unmute and ask your question.
I'm sorry. I didn't have a question. I think I accidentally raised my hand.
It's okay. That's okay. And for anyone who does have a question, feel free to raise your hand and it'll pop up for me and I'll make sure to cue you in. We do want this to be as much of a dialogue as possible. So I'll actually pull up the question from Anjanette, if I'm pronouncing your name correctly. And Anjanette, feel free to come on live to ask any follow-up questions. But she asked, what are some of the treatment options for multiple myeloma? And Dr. Cole, you spoke to a couple, but if there's anything else that you want to add, feel free to speak to those.
Yeah, it's really evolved in the past three years into I mean, to now, like I said, for newly diagnosed patients, it's running at 99 to 100%, and with 80% of those being very, very deep responses that we never saw. And it's combination therapy, and it's combination immunotherapy with these days we use four different drugs: an antibody that destroys myeloma cells, and then we use drugs that really target the myeloma cells in their environment. And so, I mentioned how much how much those myeloma cells live and thrive in the bone marrow, cause all their damage. Well, some of the medications we use today exactly target that, where it actually detaches the myeloma cells from the bone marrow. And without being attached to the bone marrow, these myeloma cells they can only live a couple days. And so we use an antibody therapy, which gets the immune system to destroy it. We use immune modulators, which detach the myeloma cells from the bone marrow, and then the immune system again, goes after them. We use another drug which actually works. I told you how the myeloma cells produce that extra protein. Well, actually, is a drug that stops up that protein being produced by the myeloma cells. And because the myeloma cells are the only cell in the body that's producing that much protein, it actually works against them and destroys them. And then we still use steroids, which kind of pull it all together. The important thing is, so the four drug therapy really does and really has become the new standard of care. People can then go to a stem cell transplant. The stem cell transplant is the chemotherapy part. And that's when, after hitting the myeloma with these four drugs, we then hit it with the stem cell transplant. And that's just one dose of chemotherapy, which pushes the disease down even further, which takes that much longer for it to come back. And it can take up to 10 years for it to 5 to 10 years for it to come back. And then when it comes back, then the playbook really opens, where there are lots of new clinical trials, lots of new therapies approved. Just about a month ago, we had two new drugs that for myeloma approved in the same week. There's no other cancer that is having drugs approved at the cadence they're being approved for myeloma, not only because people are involved in clinical trials, but it's because we're starting to figure out how we can harvest the immune system, how we can get the immune system, just like Tamara mentioned, like the CAR Ts, but how can we get the immune system, those T cells, to destroy the myeloma cells? And that's really been the cutting edge of myeloma treatment at this time. The treatment for amyloidosis is very similar to how we treat myeloma, and especially stopping up those myeloma cells from producing that protein.
Thank you so much, Dr. Cole. We have Guy who has a question. Guy, feel free to come off mute.
Hey, good afternoon, everybody, and I really enjoy this opportunity of sitting here witnessing this. My question, as a recently diagnosed patient of smoldering multiple myeloma and cardiac AL amyloidosis, my question to you, sir, is how do we get the word out to the communities, to other than what we're doing here, to get people to know that these dreaded diseases are out here?
Mm-hmm.
Now, I was fortunate enough to be diagnosed because I advocate. And by me being 170 pounds, regular blood pressure, no diabetes, nothing like that, they had to figure out why was I in heart failure. Now, normally an African American male, overweight, high blood pressure, diabetes, they would never look for it. They would look at it as heart failure because of my lifestyle. So there's so many people, I think, that may have passed from this terrible disease, but was never diagnosed. And just to me, being blessed enough to be diagnosed in a 3-month period of time for cardiac amyloidosis is amazing. as an African American. So what can we do to help get out into the communities, get into the barbershops, the hair salons, and I'm working with a different couple of hospitals like the Cleveland Clinic and Ohio State to, get out to talk to people. So what do you think that we'll see for this disease in 2 years, 5 years, and how can we make a difference? I know that's a lot to say.
Huh. No, I'm glad that you they said that, and then really that's been kind of the mission that we've had. And actually we have a two-pronged mission. Is one, the that we're going out with the myeloma patient support groups. So they're the three big ones: the MMRF, the Multiple Myeloma Research Foundation, the IMF International Myeloma Foundation, and the Health Tree. And those three groups are going out into the community to empower people, to tell them about how to find this disease and to really educate and go out. So we're going in November in Detroit. We're going to one of the biggest churches in Detroit, specifically to talk about screening and looking for both myeloma and amyloidosis. The other thing is to teach doctors. And so, I've been on the road a couple of times with the Multiple Myeloma Research Foundation to talk to doctors and really stress, that if you have someone that comes in with heart disease, or if you have someone that comes in with kidney disease or pain, it is really easy, again, to just run those three tests: the serum protein electrophoresis, the SPEP, the free light chain, looking for those fragments of protein, and immunofixation. And so we tell them, in fact, in a couple weeks, I'm going to go talk to the general medical doctors here in Lansing to, again, say over and over again, three tests can rule that out, but also telling people that, that if you have these symptoms, you have back pain, don't get dismissed. If you have back pain and they say, well, maybe you should go see a chiropractor, you just say, how about we do these three tests and I go to the chiropractor? Because if those three tests come back positive, then it's on to really definitively diagnosing the disease.
So with that being said, it's kind of, they were sending me around because I have neuropathy extremely bad. And they sent me to a neurologist. And I have a son who's a resident orthopedic surgeon. So I took my son with me, and the neurologist sees me two young, African Americans, and he's pushing us through like he normally does. And my son starts asking questions, and the neurologist asking, "Are you in medicine?" And my son, told what his status was. So the neurologist ordered all of this extra blood work, and all of this extra blood work, they showed that my AL was, my light chains was high. And everywhere I would go, it says, why did the neurologist order all of this blood work? Why? And everybody would always ask me, why did the neurologist order all of this extra blood work? And I kept saying, well, I don't know. But what I'll say, the reason was he realized that he had a doctor in the room with him, and the whole dynamics of the appointment changed. So then he took his time. He was asking my son all these questions. My son said, I'm just a resident. This is what you do. I don't know. I'm here advocating for my father. So since that time on, I learned, and I got a lot of articles and podcasts about advocating for your own health is the key. So I know we have a lot of people out here who are not the actual patients, but they're the caregivers. Advocate. Is all I'm gonna say.
Absolutely.
So I'm gonna go back on mute.
No, we appreciate you, Guy, and I know you expressed interest in sharing your story as well. We hope that the Now Included community continues to be a place where you can connect and share your story, of course. And we definitely hope that these conversations will serve as a resource for getting the word out there, right? Because even outside of this conversation and outside of the folks that are on this call now, we will post this online to YouTube so that the knowledge continues to spread. So definitely, Guy, we're appreciative of having you in the community, and hope to stay connected so that we can work together to spread the word through Now Included as well. Bobby, I see you have a live question as well. So since we're limited on time, I would love to make sure we prioritize this live question. Since we have the other questions written down, we can make sure that they are answered afterwards. So Bobby, if you could ask your question, you're gonna close us out before I transition to the closing.
Well, mine isn't a question. Mine is about the advocating. I do work with the Multiple Myeloma Fund because I had a cousin who went to the doctor and the doctors kept telling her it was just sciatica. And she was misdiagnosed. And unfortunately, by the time we got her to go to another doctor and they diagnosed her with multiple myeloma, it was too late and she died. So please, if you have any of those symptoms and crap, go to another doctor, get another opinion, but don't suffer like she did. Please, please, your health is the most important thing that you have, and it's up to you to defend yourself. Thank you.
Thank you so much, Bobby. I know Dr. Cole's one of his big pieces of advice is definitely to get a second opinion. So I'm glad you raised that. And since Bobby's question wasn't really a question, Dorothy, I saw your hand was up earlier. So I'll make the exception to make sure that you are able to speak your piece as well, Dorothy. Dorothy, if you still have a question, I know sometimes people accidentally press the buttons. I do that myself sometimes.
Am I unmuted now?
You are.
Good. Okay. I apologize because I missed the first few minutes, so I don't know if this was addressed. Is there a connection between heredity, or is there a specific age group that's more likely to be affected by this?
So usually it's adults. And so you never see myeloma in children, but the risk of myeloma goes up starting in African Americans starting at age 30 and Caucasians starting at age 40. And those risks, continue to climb through age 70 and 80. For Blacks, as the risk goes up, much higher for Blacks as we approach our 70s and 80s than all other races. But usually is found in adults, again, 10 years younger than Blacks and in other races. Is there a hereditary component? Well, the other kind of interesting difference between Blacks and other races is that it appears that, is myeloma itself hereditary? No. So myeloma, we have not found to be hereditary. There is a precursor condition, so that rarely turns into myeloma, called MGUS, monoclonal, that protein of uncertain significance. Very common, about 4% of the population over age 40 has it. Rarely turns into myeloma, but we do know that can be hereditary. So that early condition that rarely turns into myeloma is hereditary, especially among people of African descent, but not multiple myeloma per se.
Thank you.
Thank you, Dr. Cole, and thank you, Dorothy, for your question. And I like to host events in a way that allows people to have a little transition time in between. So definitely want to make sure that I thank both Tamara and Dr. Cole for your time today, and that you all have just an opportunity to close out the session with key call to actions that you want to make sure people took away. I know I summarized a little bit earlier, but if there's anything that each of you would like to add, Tamara, would you like to start with any final call to actions to the folks on the call?
Yes, definitely. And I think it's been said several times, and I've seen the chat as well, but definitely, listen to your body and don't, I guess, just assume that, that because of your age or because you're tired or you did something specific, that might be, contributing to why you don't necessarily feel good. And, take those steps to find out what's going on with you. And if you don't feel empowered to sit across from, a doctor in a white jacket, find a family member, somebody, that you trust that can go and be your eyes and ears, because it can be overwhelming when you don't feel well to, to express how you're feeling, and and to get everything off your chest. And so I say, self advocacy is super important, but engage your friends and family as much as you possibly can. I find that that my family and friends want to support, right? And sometimes the best way that they can support is to go with you and listen and ask those hard questions. But find something, that's worth living for, right?
Mhm.
Anchor into that, whatever that thing is for you. For me, it's my spirituality. Like, it totally got me through. So I would say, whatever it is that, that anchors you and that keeps you going, lean in there, advocate for yourself, live your life to the fullest. And don't ask for permission, but, put yourself first and do whatever you need to do to make sure that you can have the best life possible, considering any circumstance.
Thank you, Tamara. And Dr. Cole, anything you want to leave the audience
Yeah,
with?
but that's tough. It's tough to beat that, because I mean, that's exactly what I would say, is that, in 2023 and moving forward really is the era of patient advocacy. That you really do have to, in the doctor side of things, things run really quick. I mean, and there's a lot of pressure to do this and do that and do that when you're a doctor. So we really do need patience to say, time out, slow down. I have to do this with my own doctor. Time out, slow down, listen to what I'm saying. And if your doctor isn't validating what you're saying, then move on, because you need to be validated. You need to have your concerns, completely answered before you leave the room, or at least a process to begin that, your questions being answered. That you need to advocate for yourself in 2023 and 2024. That includes that when people are diagnosed with myeloma, getting second opinions, because myeloma is evolving so quickly these days, that getting second opinions, hearing other people about, the new treatments and everything that's going on is really important, because myeloma is evolving so quickly. Hearing about the new exciting things and the opportunities for treatment is critical when you have this disease.
Thank you so much, Dr. Cole. And now that the important people have spoken, I am launching a poll as I share kind of my final call to action. And this poll that y'all see on your screen is really helpful for us to understand how impactful this session was, right? And what you all are taking away. And after you finish that poll, it's 6 questions. If you could maybe drop a topic that you'd like us to cover in the future, because if this is your first community event with Now Included, it hopefully will not be your last, because in addition to multiple myeloma, we cover a number of topics. The last session that we had was about gut health. If you follow us on Instagram, then you see that we cover a host of different topics there. And again, the goal is to show that together we do thrive, and that you can have all of the different resources that are necessary to make more informed health decisions. So we definitely are excited to keep in touch with you over time. And that's at now_included on Instagram, and our website is nowincluded.com. So I see some folks filling out the poll already. Definitely feel free again to drop any topics that you want to cover in the future in the chat. But with that, again, a huge thank you to Dr. Cole and Tamara for your time today. Maybe some emoji claps for our great panelists. Hopefully y'all can see all of the love coming through in the emojis and on the side. Dr. Cole shared his contact information, and you will be receiving a recap email so that you know how to keep in touch with us. As y'all are filling out that poll, I'll keep it open and just share this beautiful video of Tamara that we have on YouTube. So if you want to hear more snippets of Tamara's story, then that is there. But with that, thank you everyone for making the time today, and we hope to see you soon.